Have you ever really thought about what happens to a medication after it's done its job? It doesn't just vanish. Your body has this incredible, super sophisticated cleanup crew that works around the clock to process and remove these things. So today, we're going to follow that journey and see exactly how this amazing internal system gets the job done.
Okay, so take a look at this. This is basically our roadmap for the whole process. It shows the drug's entire life cycle. First up, you've got administration. That's just how it gets into your body. A pill you swallow, a shot, whatever. Then it gets distributed through your bloodstream to where it needs to go. But what we're really focusing on is this last part, elimination. The many, many ways our body clears it out. From the ones you'd expect, like urine, to some you might not, like your breath or even sweat.
So let's get right into it. What exactly is drug elimination? Well, you can think of it as your body's ultimate safety mechanism. It's that critical final step that prevents medications and other foreign stuff from just building up inside you to dangerous levels. Now, the key word on this slide is irreversible. Once a drug is marked for elimination, it's a one-way ticket out of your body. And this all happens in two main stages. First, there's biotransformation, which is really just metabolism, changing the drug's chemical structure. And second, there's excretion, which is the actual physical removal.
Let's start with that first step, metabolism. I want you to think of it like a massive processing plant. Its main goal isn't necessarily to destroy the drug, but more to repackage it, get it all prepped and ready for shipment out of the body. So, this biotransformation, it's all about chemical conversion. See, most drugs are designed to be fat-soluble, or lipophilic, which helps them move easily through the body's membranes. But that same property means they could get stuck in your fatty tissues forever. So your body has this genius solution. It chemically changes them into water-soluble forms, which the kidneys can then just flush right out. The analogy here is perfect. It's like taking apart a huge piece of furniture so you can actually fit it in the recycling bin.
And where does all this happen? Where is this factory located? Well, while a bunch of organs can help out, like the lungs and kidneys, the liver is the undisputed superstar of the show. Seriously, it's the main factory floor, handling almost all of this complicated chemical work. The other organs are great supporting actors, but the liver is the main event.
But the liver's job isn't just one simple step. Oh no, it's a really sophisticated two-phase system. You could call it an assembly line, but actually, a disassembly line is probably a more accurate way to put it. So here's how this two-step cleanup works. In phase 1, called functionalization, the body's enzymes tweak the drug molecule a bit, basically adding or exposing a chemical handle. Then, in phase 2, conjugation, the body grabs a water-loving molecule and sticks it right onto that handle. This acts like a big, bright get-out-of-here tag, making the whole thing water-soluble and ready for removal. It's a simple, brilliant system. First you prep it, then you tag it. And you can see that whole process in action right here. A xenobiotic, and don't let that word scare you, it's just a fancy term for any substance that's foreign to the body, like a drug. It goes into phase 1. It gets converted into a metabolite. Then in phase 2, it gets conjugated or tagged. The big takeaway from this visual is that every single step is designed to make it more water-soluble, making it way easier for the kidneys to finally get rid of it.
What's really cool is that these two phases kind of act like a traffic controller, directing the processed drug to the best exit ramp. The products from phase 1 are usually smaller and water-loving, so they're perfect for renal elimination, which means they head out through the kidneys in your urine. But sometimes, the products from phase 2 are bigger, so they're better suited for biliary elimination, meaning they exit through your bile and into your feces.
Now, this is where things get really, really interesting. If this whole process was exactly the same for every single person, medicine would be, a whole lot simpler. But it's not. There are tons of factors that can speed up, slow down, or just plain change how your personal processing plant operates. And that's not an exaggeration. It's absolutely true. This whole system is so finely tuned that something as simple as what you ate this morning can have a real impact on how a drug works in your body. It's just a powerful reminder that our internal chemistry is incredibly unique.
And the factors at play are all over the map. You've got internal things we can't really control, like our genetics, our age, and our sex. And then you have all these external factors, right? Like our diet, any diseases we might have, and even other medications we're taking can interfere with the whole process. So here's a classic real-world example you might have actually heard of: grapefruit juice. It turns out it contains compounds that block a really important drug metabolizing enzyme, CYP3A4. So if you're taking a drug that's processed by that specific enzyme, like certain statins for cholesterol, the drug doesn't get broken down as fast. Its levels can build up in your blood, sometimes to dangerous levels. That is exactly why your pharmacist puts that little warning sticker on the bottle.
And genetics, wow, they play a massive role. Just look at this chart. It's showing the percentage of what are called slow acetylators in different populations. These are just people whose bodies process certain drugs more slowly because of a specific genetic variation. And the difference is staggering, right? This isn't some small little variation. It has huge implications for figuring out the right and safe dose for people from different backgrounds.
Okay, so the drug has been processed, it's been tagged for removal. Now for the grand finale, excretion. How does the body actually show it the door?
The main exit gate, the superhighway out of the body, is through the kidneys. And the real workhorse here is this microscopic little unit called the nephron, which you can see in this diagram. It uses a really efficient three-step process. First, blood gets filtered. Second, waste products are actively secreted, basically pushed into what will become urine. And third, the body reabsorbs anything it needs to hang on to, leaving only the waste in the processed drug to be flushed out.
So you might be wondering, how in the world do scientists know what's happening inside that tiny little nephron? Well, they use this really clever measurement called a clearance ratio. By comparing how fast a drug is cleared from the blood to the kidney's normal filtration rate, they can figure out the whole story. If the ratio is 1, it's a simple filtration job. If it's greater than 1, it means the body's actively pushing the drug out. But if it's less than 1, that tells them the body's actually pulling some of that drug back in. Pretty smart, right?
Now, while the kidneys are the main highway, they aren't the only way out. As we mentioned, bigger molecules can get tossed out via bile into your feces. Volatile stuff like the gas from general anesthesia or even alcohol can actually be breathed out through your lungs. And believe it or not, tiny amounts of certain drugs can even exit through your saliva, your sweat, and for nursing mothers through breast milk.
And all of this brings us to a really big, thought-provoking question. Understanding all these variables, from our DNA to our diet, is really the foundation of what we call personalized medicine. The more we learn about why one person's body handles a drug differently from another's, the closer we get to this future where every single prescription is tailored not just to an illness, but to the unique patient. So, how do you think medicine will change when your doctor can prescribe a medication based not just on your symptoms, but on your body's unique genetic blueprint?